Hello, everyone. Thank you for joining. Just to introduce myself, my name is Natalie. I'm from Similied. I'm the product specialist for Kyoto Gagaku, and I'm based in Lebanon. I have a brief presentation about today's demonstration is the abdominal examination simulator from Kyoto Gagaku. It's MW43. I will share my screen. Okay. I believe you are able to see my screen. So as I said, today's demonstration is about the abdominal examination simulator MW43 from Kyoto Kagaku. What are the training skills for this simulator? First of all, we can observe, so the visual inspection for the abdominal regions. We can auscultate the simulator. So what are the sounds that in the simulator: renal breath, aortic breath, iliac artery breath, and bowel sounds. We can palpate the simulator in the liver, spleen, kidney, uterus, and inguinal area, and percussion in the liver, spleen, and rib. What are the regions for assessment? First of all, to start with the bony landmarks, we can palpate the pelvis, ribs, lower rib cage, costal margin, xymphisternum, pubic crest, and anterior superior iliac spine. What are the organs, interchangeable organs for the liver? We have the normal, chronic hepatitis, early late cirrhosis, and cirrhosis. Those are the interchangeable organs. For the inguinal area, we have the normal and lymphoma. For the spleen, we have the normal, slightly enlarged and enlarged. For the kidney, normal, hydronephrosis, and polycystic kidneys. So those are the interchangeable organs. For the uterus, we have the normal and myoma. And so those are the liver, inguinal area, spleen, kidney, uterus for palpation. And for auscultation, the breath sounds are the renal artery, abdominal, which is the bowel, iliac artery, and the bowel sounds. Now I will move to the Now I will move to the product demonstration. So just a quick recap. This is our main torso. This is our main torso, along with the simulated stethoscope that is linked to the controller. The power, I have linked to it a speaker. It doesn't come with the set, but just for us to hear the auscultation sounds. It comes with the baby powder in order once we finish our exercise, we put baby powder in order for the skin to have this tactile feedback. This is the uterus. So we have the normal one. We can remove the normal uterus and place the fibroid uterus. Along with the inguinal lymph nodes, we have one normal, and this one is lymphoma. So we have the kidney, and we have, when we don't put any organ, it represents normal kidney. And when we put one of them, this one represents a hydronephrosis and this one cyst. Those are the spleen, slightly enlarged and enlarged. And we have 4 interchangeable organs for the liver. So as you can see here, we have, this is the normal. This is the cirrhosis, pre-cirrhosis, and chronic hepatitis. So we have 4 interchangeable organs for the liver: normal, cirrhosis, pre-cirrhosis, and chronic hepatitis. We have for the kidney, normal, cyst, and hydronephrosis. For the spleen, we have the normal, slightly enlarged, and enlarged. For the uterus, we have the normal and fibroid. And for the inguinal lymph nodes, we have the normal and lymphoma. This part is for the auscultation, is for the palpation, and the controller is used for the auscultation. If you can see here, I'm just going to show you the speakers. So here we have the speaker. This doesn't come with the set, but you can use any speaker for classroom training, so that when we have 30 attendees, they can hear the auscultation group learning. And here for the respiratory motion unit, this is the foot paddle. So once we put the liver inside the body, this is the foot paddle that can be used in order to simulate inspiration and expiration for the liver motion. Okay. To start first with the palpation, how we can put the interchangeable modules. So first of all, we can remove the upper torso, and we can place one of the livers in this way. And when we press on the foot paddle, we can feel the inspiration and now the expiration. So here we can palpate the liver. So now expiration. The same thing will be applied with other interchangeable organs for the liver. So if we put one of them. So this part is for the liver. The second part, how to put the interchangeable modules. We can lift it, open, and put one of the kidneys. So as you can see, the head, the arrow, we have it up. So this means that they tell us the position should be in this, okay? So we have the circle for the upper position, and we see the arrow and work accordingly. Okay, now we put the interchangeable kidney, and we are ready to palpate. On the second place, we can put one of these pins. Again, the head up. So the button up and the arrow at that position. Okay. Let's put the liver. Okay, so we have placed the interchangeable organs, normal liver, cyst for the kidney, enlarged spleen, and normal uterus with a normal inguinal lymph node. And we can palpate the simulator by using the foot paddle for the respiratory motion for the liver. So this is the part of the palpation. Of course, for the liver and the spleen, we can do the percussion. Now we will start with the auscultation. I want to show to you the controller, how we work on it. Therefore, as I said, we have so this is the simulated stethoscope. We have the arrow up, we put it here, along with the power. Okay, and the speaker. We turn it on and should be ready to use. Okay. As we can see here on the controller, I'm not sure if you are able to see. So we have those auscultation positions, sides. So we have the renal artery left and right. We have the aorta, renal aorta. We have the CIA, and we have the bowel sounds. And here we have the cases. For the bowel sounds, we have normal and pathological bowel sound cases. For the renal artery and aorta and CIA, we have the normal sides. So how we can auscultate? I want the bowel. I press on it 2 seconds. This is by default the sound, and this is, we can change the number of cases. I want it increased. I click on this button, the case number 1. We see it here, the case is number 1. Okay, so I press it again 2 seconds, 1, 2. It comes with these lines. Press the green button, and now ready to auscultate. Okay, so are you able to hear? Yes, it's increased. Okay. So if I want to have obstruction, for example, I press on the bowel and I put for the obstruction number 3. I wait 2 seconds and then click on the bowel. Now we will hear obstruction sound for the bowel. Okay. And the same thing will be applied for the renal artery, aorta, and CIA. Okay, just something to note that for the bowel, we have the normal and 4 cases, increased, decreased, obstruction, and ileus. For the renal artery, aorta, and CIA, we have the normal sounds. Any questions? Hello.
Yes, we can hear you.
Okay, any questions for the demonstration? This is from my part. Okay, so thank you for attending, everyone. Thank you for your time and attention.